Good evening, everybody. I am John Green. I am the CEO of Iredell Health System. I want to thank you for taking time to come this evening. Whether you're here in person, down in the cars in the parking lot, or whether we have you online. We appreciate you thinking about us and taking us as we remember a tumultuous and really chaotic year that was. When I look back, on March 5th, 2020, we had a board of directors meeting of the hospital. And on that evening, the minutes of that meeting reflect that we talked about the education we were starting to provide our staff and the fact that we were starting to look at the potential of a pandemic coming and the potential of this disease being in North Carolina. At that time, there was one case in Greensboro. Fast forward 6 days later to March 11th, 2020, truly 1 year ago from today. And on that day, the World Health Organization announced a global pandemic. If you're a sports fan, you'll remember it because multiple tournaments stopped. Basketball tournaments stopped in the middle of the games. Golf tournaments stopped in the middle of rounds. Every other sport stopped. Businesses started to close rapidly and quickly. And it was also the first day that Iredell Memorial Hospital had a patient with COVID in our facility. Fast forward 365 days later. It's been challenging, it's been frustrating, it's been fatiguing for all. But what we have also seen is determination, resourcefulness, and strength, both from our community and from the folks that work in this facility. You see in front of you 86 luminaries. Each of those luminaries stands for 10 individuals that were admitted to our facility. So over the last 365 days, we have had 860 patients in our facility with COVID. Many of those have had the opportunity to go home. Unfortunately, not all did. And we are obviously always saddened that some succumbed to the illness and passed away. The challenges that our clinicians faced over that year is unmanageable for me to describe, and I wouldn't even try. So what I did was I took the smart road. I phoned a friend, and I brought in reinforcements. So what I have done is I have asked 3 of our clinicians to share their comments for you about this past year. First, I have speaking Danielle Pinnell, who's clinical coordinator in our ICU. Danielle.
Good evening. I am Danielle Pinnell. I am one of the clinical coordinators in the ICU. I've been a nurse for 13 years, mainly ICU, CCU, and I've been here for 6 years. Reflecting back over this last year has definitely been a roller coaster of emotions. 1 year ago today, we received the first COVID patient in the hospital to the critical care unit. Since then, there have been many more to follow. Taking care of COVID patients is like taking care of a family member. These COVID patients have become like family because the nursing staff is sometimes the only physical contact they may have. Thank you. Sometimes just holding the patient's hand and telling them they are not alone is all the comfort they need, while the patient's fighting to breathe and pleading with us to help them. Us nurses are holding tears back silently because we know that we are doing everything we possibly can with the limited knowledge of the new disease. Some of the COVID patients' only request was to FaceTime or call their loved ones before they were intubating, knowing it may be the last time that they spoke. We have come to know the families of the patients just like our own. The patients admitted to the ICU suffering from COVID are not usually there for a short stay. Therefore, we have come to know the families even though they have never stepped foot in our unit. We have smiled with families, we have laughed with families, small jokes with families. We have celebrated small but meaningful improvements in their loved one's condition. We have all cried. We have all cried with the family members because after the unfortunate ones have lost their battle with COVID are gone. We are the last ones to be with them. And it is difficult for us nurses as well, because we know we are doing everything we can to take care of these patients, even though we can sometimes perceive the dreadful outcome. I remember in the beginning, the CDC recommendations were changing daily, and all we could do was go along with the changes. Everyone was scared of what was going to happen because none of us have ever worked in a pandemic. The news about COVID was ever changing, and all we could do was wait anxiously for the storm to come. However, we were supported by each other and our community. Walking into the hospital and seeing the chalk art, signs, and posters gave a sense of pride to know that we were doing everything we possibly could during this challenging time, and our community knew it. We are thankful for all the support, love, and prayers that everyone has showed us during the ongoing pandemic. We are hopeful that with the vaccine and the decrease in COVID numbers, that we are on the downside of this pandemic.
Thank you, Danielle. Next, I'd like to bring up Kelly Roten. Kelly is a nurse and the assistant director of 5 North.
Good evening. 1 year ago today, COVID became a reality for the employees of Iredell Health System. There was so much revolving around this new virus. What was COVID really? Who would get sick? And how would this virus affect the Iredell County members? Over the next few months, we would learn that this virus was much more than a tiny microscopic organism. It was a life changer. This virus would lead to 5 North, which had previously housed the surgical patients who were typically pretty healthy, to turn into a COVID unit. Surgical nurses turned to COVID nurses. Nurses and CNAs stepped up to the plate when so much of the world was stepping back. We underwent training to care for these patients, not really knowing what to expect. But no amount of training can prepare us for how this virus affects a person. On multiple occasions, we have had entire families hospitalized. We've held the hands of a patient as they heard the code blue called through their spouse's room. We have sung Amazing Grace to dying patients who couldn't have family with them because they were too sick themselves or afraid of catching the virus themselves. We have arranged countless video calls with friends and family to help encourage our patients as they struggle to breathe. We've coordinated last visits with other departments to see their family members. We have prayed with church members who were worried about their fellow church member who was just right across the hall from them. We have seen pain, we have seen guilt, and we have seen death. But we have seen happy too. When asked about my experience with COVID, I'm often heard saying that it hasn't been all bad. We have seen the smiles, we have seen the joy, and we have seen the relief of our patients as they're discharged home. We now celebrate these discharges with a Code Sunshine, where we line the halls, we shake pom-poms, and we cheer, and we play music. The happiness that we all feel during these moments are moments that we will never forget. While we've missed our friends from the physical therapy department, a department we see daily, to now only seeing occasionally, we've strengthened our relationship with respiratory, a team that we now rely heavily on. We've also strengthened bonds with other departments such as ICU and pharmacy, and also with each other. We have had each other's backs, and we understand what a hard shift was like when our loved ones at home didn't. We have shed tears together, we have laughed together, and we have celebrated the obstacles that were overcame together. We have all pulled together during this time, this pandemic, and we will continue to stand strong together for our community. Thank you.
Thank you, Kelly. Now we will have remarks from Bob Noble, the Director of Respiratory Care.
Good evening. Although the media has recognized hospital departments like nursing and respiratory care throughout the pandemic, tonight I would like to recognize each individual of our Iredell Health System family, because it has taken all of us practicing our core values of integrity, respect, collaboration, and compassion to provide our patients in our community with the most excellent care. This past year has been scary and stressful for our staff fighting an unknown disease. Our Iredell community reached out to us with love, compassion, and concern. You sent us cards of encouragement, gifts, meals. These made our days brighter and gave us hope. One morning last spring, driving up Brookdale Drive to work, I turned into our emergency entrance and I saw a large sign on the hospital lawn. It said, "Heroes work here." I was overcome with emotion, my eyes welled, and it was then that I knew we were going to beat this thing called COVID. Over the year, we have celebrated the victories of our patients who conquered COVID and went home to be with their loved ones and family. We have also mourned our patients who succumbed to the disease, often holding their hand in compassion as they passed because their family could not be there with them. In my 30 years as Director of Respiratory Care, I have never been as proud of our Iredell Healthcare family as I am now. These luminaries are here to celebrate the victories of our patients and also to mourn and remember the patients, families, and loved ones of those who have passed. Please join me in a moment of silence as we remember all of the individuals who have lost their lives to COVID, as well as those who have won their battles and those who are continuing to fight. Thank you.
Thank you, Bob. You know, I thank Danielle, Kelly, and Bob all for sharing. This has been a difficult year for all. You know, I'd like us to really all keep in our hopes and our thoughts and our prayers those who lost a family member, a friend, a loved one. Additionally, you know, those afflicted and or still fighting the disease. Additionally, we have to think about those that are struggling financially, all the other challenges that we have had that COVID has created for our economy and our communities. Importantly, I want to make sure we have our hopes and our thoughts and our prayers for the healthcare workers here at Iredell Health System. You know, they've been absolutely rock solid. You've heard 3 of them, and I'm so proud that they call me, you know, a coworker, a teammate. But I'd also want to make sure we include healthcare workers throughout the region and honestly the country. You know, and first responders, essential workers, anyone that has had to continue to work out in the community while this disease has been raging and having a position where they were putting themselves at risk to keep the economy in any form or fashion moving forward, which is really what the challenge has been for us. You know, my message to all of them, our message is to stay strong and let's finish this fight. You know, we would all want to will this pandemic away. There is nothing that would make me happier. I'm really glad they put Kleenex up here. This goes to show everybody has emotion. Thank you. We all want to will this pandemic away. There would be nothing better for all of us than to be able to say, you know, let's just have this done. Inpatient numbers are down. Vaccinations are up. The weather's beautiful. Can we just go back to whatever we consider normal and just forget this is happening? And our message to you on that is we can't. We need more patience. We need more time. While we're certainly improving with more vaccinations and a reduction of the number of individuals hospitalized, we need to see those numbers continue to go down so that we can have a community that is healthy and safe. Nelson Mandela once said, "I am fundamentally an optimist. Whether that comes from nature or nurture, I can't say. Part of being optimistic is keeping one's head pointed toward the sun and one's feet moving forward." When I listen to that quote and I look to my right and I see multiple white tents that we use for vaccinations, and every weekend we have 2,000 to 3,000 cars going through our little parking lot and getting shots so that they can work toward resolution, that is optimism. When I think about the care that our staff provides every day in our facility and stays strong through this, that is optimism. And I have confidence that we can continue to work there, and we will stay strong, and we will press forward. And as we press forward as a community, we will be successful. And I thank you all for being part of that. I recognize at this time that some folks might want to come up and just have a moment with the luminaries, or just a moment just to pause and ponder and pray, whatever is right for you. We're happy to have you do that. We would ask that you try to keep socially distanced so that we can all be safe and protected. Additionally, when you go home, I would ask you to turn on your porch light if you haven't. Recognizing that we would love to see throughout our community porch lights on tonight to help us show the optimism, to help us think about walking toward that sun and moving forward. Those lights can be a beacon of the sun for us throughout this evening. With that, again, I thank you for all you have done for us. We are here for the community, and the community has been here for us, and we expect that to continue, and we look forward to the day that we can truly defeat this pandemic. Thank you.